Counseling, Psychology at the University of Rockhampton, and a Chartered Counseling Psychologist. Mick was recipient of the 2014 Carnegie Harari Mid-Career Award from Division 32, Humanistic Psychology, for the American Psychological Association. Mick is also author and editor of a range of texts of people-centered, existential, and relational approaches to therapy, including existential therapies, working at relational depth in counseling and psychotherapy, and pluralistic counseling and psychotherapy. Mick has also led a range of research studies exploring the process and outcomes of existential and humanistic therapy, and is currently leading a nationally funded trial of school counseling with young people. Mick's latest book is Existential Psychotherapy and Counseling, Contributions to a Pluralistic Practice. Mick lives in Brighton, in the UK, with his partner and 4 children, and he tells me that's one of his greatest accomplishments, his children. So please, let's give a warm welcome to Mick.
Thank you very much. It's a real pleasure and an honour to be here. I just wanted to start off by saying that I can talk quite quickly at times. I've got what's known, my accent is what's known as a North London mumble. Sometimes people think I'm from Canada or Australia, so if I'm talking very fast, just slow me down, just put your hand up and say slow down. But I wanted to talk about, it's Olivia, thank you so much for inviting me, Paul and Lillian and the committee. What I'm going to talk about is a kind of some work that I've been doing around trying to develop a comprehensive model of understanding psychological and therapeutic change. And it's a model that is very much informed by a purpose and a meaning-oriented approach, but one that tries to create a framework for encompassing a wide range of different perspectives. I think as we know that many of our helping theories, we can really think about it as a kind of Tower of Babel. So many different languages pitted against each other, so many different perspectives and views about how change happens and how people can most be helped. And often we think about the kind of meaning and purpose-centered approaches at the margins of that, as if there's CBT, humanistic, maybe psychodynamic, and then the purpose-oriented approaches are less central, less core to these different models of change. And what I want to propose instead is a model of thinking about change where actually these purpose-centered models are quite at the very core of how we think about change and how change happens. So not that meaning-centered approaches are a kind of sideways approach, but is really there at the core of not just our work, but the work that all therapists do is a focus on purpose and a focus on meaning, that it's core to the community. So I want to propose a kind of teleological model, and it's a model that is common across a number of different thinkers, and people have been working towards this kind of model. And then show that how it can be informed by a meaning or a purpose-centered approach, but then also something about how it can learn and how a meaning and purpose-centered practice can also learn from that common model. And it's work that's been developed, and the slides will be available. It's work that I've been developing over a number of years. I was just talking to Clara, I was saying it's a bit more, this is kind of at the edges of the work I was doing. I was thinking about whether I should do something safe here, come along. And when I was asked, when Paul asked me 6 months ago or so, I thought I'd do something a bit more innovative, which now I'm really regretting. I wish I'd done something that was safe and I knew, but hopefully it's going to make some sense what I'm talking about. So I'm going to talk about this idea of purposes, wants, goals as a kind of key construct that's been developed in the psychological therapies. And then talk about how we can think about purposes as being in a hierarchy. Talk about problems in living and how we might use that as a way of understanding people's problems in living. And then how that can integrate different models and different approaches. I'm then going to talk about how, if you think about this shared purpose-orientated model, the unique contributions of the work that we do here in the existential and meaning-oriented fields, and then look at the kind of role that social and political factors can have in that. And then finally go on to look at how this can also inform the shared vision, the shared framework can inform meaning-centered practices. So let's start off by talking about what a teleological psychology looks like. Teleological is really about being forward-thinking, something which is looking towards the future and where things are going to. So the existential and the meaning-oriented approaches are all rooted in the idea of teleology. That as human beings, and this is really core to everything about the existential approaches, that as human beings, we're not simply caused to do things, not in the psychodynamic model that would look at causes and what makes us the way that we are. Existentially, we think about people as being active agents, moving forward in their lives, making choices, moving towards goals and purposes and reasons. That we do things for reasons, not for causes. We're not like machines that are made to happen. We're active organisms that are moving towards our futures and our possibilities. And this idea of the person as being future-orientated, as being meaning-orientated, has been there now in has evolved in a number of contemporary ideas. And not just in the existential field, but I think very importantly in some of the key psychological domains. So we have things like work on personal projects by Brian Little. Franz Casper in the psychotherapy field, Klaus Grabe, who talked a lot about plans. We have people like Locke and Latham who talked about goals. Cantor, very well-known psychologist, talking about life tasks. Personal strivings from Emmons and Diener and people. So many people in positive psychology, straight psychology, social psychology have been moving towards the kind of revolution that we've seen in psychology, which is moving towards understanding people in terms of the goals and the aims that they're going for, rather than focusing on mechanisms and courses. So it's become a real change. And lots of people use different terms to describe what it is that we're working towards, these teleological kind of endpoints that we work towards. We can talk about purposes, we can talk about desires, and the way that we have desires that are things that we want to have. The term that I actually favour, and I'll be using throughout this talk, though it's fairly interchangeable with goals or purposes, is wants. I like the term wants. It's a very simple term about what do we want and what do people want in their life, and the idea that we want things. And that not that we need, because need becomes quite a mechanistic term, we're driven by these things, but we want. And that we move towards the things that we want in our lives. And that setting wants for ourselves and then moving towards those wants is a key area of, it is a key concept for change and for development in the same way that purposes is. Now, where are these wants come from? What are their sources? Well, they may be physical wants, they may be wants for things like food. They may be psychological wants, like for self-esteem and a sense of self-worth. It may be things that come from a social want. It may be that our wants are determined within a social nexus. So, for instance, my daughter, who's here, my 14-year-old daughter, who is here at the conference, her main want these days is to watch Gossip Girls. Has anyone seen Gossip Girls? Which is the worst. I mean, on Netflix, it's got like less than 1-star rating. It's so bad. But she, her want is to watch that. Now, that's pretty partly kind of psychological, what it does for her, but also there's a social nexus of her friends and the community. We're talking about that. And one of the things about purposes and desires is we can think about them, as Frankel really talks about, as having these interconnected levels and coming from different places. And also spiritual wants, that what we want, as well as being psychological, and Frankel talks about this in a great deal of depth, is that our wants can come from a spiritual place of wanting spiritual succor, having these spiritual needs. And often the things that we want, or our purposes or our goals, are a kind of complex combination of all four of these different different sources. So that the concept of purposes, I guess what I'm trying to say is the concept of purposes encompasses all these different levels. Wants can also be kind of immediate, so it might be very immediate. For instance, I want to get through this talk and I want to do a good presentation. That's my immediate want right now. And I want to try and talk clearly. But it can also be much more long-term objectives, like I want to be a respected psychotherapist, and I want to be a speaker. And our wants can be at these different levels, and I'll say some more about that in a minute. there's some very interesting work. And one of the reasons I wanted to do this talk is to say, you know, there's this mass of research findings and data in the psychology field that we can draw on when we're thinking about purposes and meanings. And some of the most interesting work has been around by people like Elliot and colleagues, have looked at the difference between approach and avoidance goals. And they look at the way that we can think about our wants, either as being wanting for something, so that we might want, for instance, my desire might be more creative, or it might be an avoidance goal, that I want to avoid heights, or I want to avoid feeling afraid. And in fact, what Elliot does is he argues that, you know, people tend to be more approach-orientated or more avoidance-orientated. And his research shows that where people have approach goals or approach purposes, that they tend to function better, they tend to achieve them more than when they're trying to avoid something. It's interesting when we think about that, when we think about in our work setting goals with our clients, being aware of maybe working towards approach rather than avoidance goals and helping people think about their lives in more approach-based ways. Also intrinsic and extrinsic, and here we have the work of people like Kenneth Sheldon and Casa in the social psychology field, that our wants can either be something that's very much connected to our deep sense of self. It may be about fulfilling some need for relating, closeness with others, or for a sense of self-worth. Or it might be that our wants are much more about wanting to do things to please other people. And again, there's very interesting research that shows that where people's wants are intrinsic, that they tend to bring more happiness, more satisfaction. When they're extrinsic, the research shows that they're less likely to be fulfilled. People whose wants, for instance, are for money are less happy when they get those goals than people whose wants are for relating. So that intrinsic, extrinsic dimension, when people talk about ideal or learning versus performance goals, seems to be an important dimension as well. Also very importantly, what we've learned over the last 10, 20 years or so about our purposes, our desires, is that they can be very conscious. So we can be very aware of what I want. For instance, I know that I want closeness with people, and that with my partner, it's very important for me to be close. But also we know very clearly, and this is something that kind of goes against my phenomenological grain, but the research really shows it, is that sometimes our wants can be unconscious. Our desires, our purposes, Frankl, of course, talks about the way that our desires can be unconscious. And there's a lot of very strong research now to show that people, the purposes that people hold, the goals that people hold, often operate in an unconscious level, and they're not aware of them, but they can very much direct behaviour. There was a really interesting series of studies by Wong and colleagues. And what they did was that they did things like they asked people to do word tasks, like word search tasks. And they would have certain things, maybe relational terms, and they had to find relational words. And then they were asked to do another task. And they looked at whether they cooperated more or were more competitive. And where they were doing word searches, where there were more cooperative words, they would then go on to behave in more cooperative ways. But when they were asked why they were behaving in those particular ways, they couldn't say that this was because we did the word search. So these goals were operating and they were there, but they were at very subtle, implicit levels rather than in explicit levels. And in many ways, we can think about mental health work as about helping people to become more conscious of unconscious goals, and I'll talk a bit more about that in a moment. Now, wants or desires or goals or purposes, what we also learn from the psychological field is that our relationship to the purposes that we aim for, our relationship to our goals, is fundamental to our well-being. As in Paul's book, Klinger, quote from Klinger, the human brain cannot sustain purposeless living. It is not designed for that. Its systems are designed for purposive action. When that is blocked, its systems deteriorate, and the emotional feedback from idling these systems signals extreme discomfort and motivates the search for renewed purpose, renewed meaning. We are, and the evidence shows this very clearly now, we are meaning-oriented beings, and that when we don't have those meanings, exactly as Frankl says, we suffer. The difference is today we know that very strongly from the research evidence, including people like Michael Steger, whose meaning life measure, I think we'll be talking about that later, been very instrumental in helping us establish very clearly that link between a sense of purpose and sense of meaning and well-being. But what's interesting, and I think what can help us again expand our thinking in the meaning-oriented field, is that it's not just the presence of a sense of purpose that is important. So we know, for instance, that when people have an orientation towards, when people are conscious of what they want, they can experience a sense of meaning, a sense of purpose, a sense of direction, and that without that they can experience meaninglessness, disorientation, chaos, despair. But also what's important is the sense of whether you feel that you can attain your wants or not. And when people feel that they can attain their wants, there's a sense of hope, optimism, control. And without that, there can be a sense of hopelessness and futility. Even more than that, we also need to think about people's progress. You know, it's not just about having a sense of meaning and a sense of purpose. What the research shows is also that whether we feel we're moving towards the goals that we have for ourselves, whether we, and Carver and Shear, who's done a lot of very interesting research on this, talk about, we have a kind of sense of the speed that we should be moving towards our goals. We have a kind of implicit sense of speed. And if we're going faster than that, then we feel good about ourselves. If we're going slower than that, then actually that can lead to feelings of things like frustration, failure, disappointment. So it's not just about having meanings, it's about a sense of moving towards those meanings. And also, ultimately, whether we attain the things that we want or not. And if we can attain the things we want, it can give us a sense of satisfaction, of accomplishment, fulfillment, and not accomplishing the things that we want can lead us to a sense of dissatisfaction. And I guess this research is important for us in the meaning-oriented field, because what it suggests is that we can't just focus on do people have a sense of meaning or not, but there's also questions about are we moving towards our meanings, are we actualising our meanings, do we attain our meanings, are also very important questions. One of the interesting things about this model also is that if we think about, and Frankl talks about this in the reflection, what happens if some of our goals are about our emotions themselves? So for instance, suppose we have a goal to feel happy. So if we have a goal to feel happy and we feel we're moving towards that, then that can make us feel more happy, and that becomes a virtuous cycle. But if our goal is to feel happy, and then we don't feel we're moving as fast towards that, and that can lead us feeling more down. And because we feel down, that makes us feel less like we're achieving our goal, which makes us feel more down. And we can then get into vicious cycles, either in a positive direction or in a negative direction, which can have an important influence on our being. And I think in my own clinical work, so often what I see is that clients are feeling down because they're feeling down. You know, there's a sense that I should be feeling good about myself, I should be feeling happy in life. And when they're not there, it can lead to a sense of disappointment, a sense of failure. And Emmy Van Derzen, the UK existential therapist, talks a lot about this. And she talks about the problems of the society that we live in when people have such high expectations for happiness, and the importance of perhaps having a realistic sense of what we can achieve. Okay. So I've talked a bit about this idea of kind of purposes and goals. And what I want to suggest now, and again this is something that's been suggested by a number of people in the field, is that we can think about these goals as existing in a hierarchy. That we can have these kind of, people like Powers particularly talks about this, about the way in conceptual control theory, about the way that we're going to have lower order wants and higher order wants. And the lower order wants are the ways that we can achieve our desires, our purposes as at a higher level. And what's at the highest level has been theorised in different ways by different people. So for instance, Freud talks about pleasure and death. Adler, who Frankl was very influenced, talks about power. Frankl talks about meaning itself, kind of having goals itself, is at the highest level of goal. I think in having a model like this, a hierarchical model, we don't have to say, now we know what is the higher order goal. Research around this is very interesting. Self-determination theory, for instance, suggests that the three highest order goals, purposes that we have, one is for relatedness, one is for competence, and one is for autonomy. And that's been quite widely established within the research, but I'm sure there's many different ones that we can think about. And the things that we do in our lives are all ways of attaining these higher order goals. So, for instance, somebody's goal structure might look something like this. For instance, the things that might be most important for me in my life is to have a sense of autonomy and to feel related to other people, and then to have a sense of competence. And also maybe physical pleasure is an important goal. And it may be many other things. For instance, I could put spiritual needs at the top there, at the top of my hierarchy of goals. And it might be then, in terms of relatedness, well, how do I get relatedness? I get that through intimacy, with my partner, and perhaps with my friends. So I can have sub-goals which allow me to achieve these higher order goals. And this might be the same for everybody, but probably different people are going to have very different hierarchical structures in terms of their goals. And two of the basic principles that are talked about here are often equifinality and multifinality. So equifinality means that each goal can be attained by several different means. So for instance, the goal of intimacy. There's lots of different ways that I can feel intimate with somebody. I can be close to my partner. I can be close to my friends. I can have intimacy with my children. But there's lots of different ways of achieving those long goals. And the other principle here is multifinality, which means that any one means can attain a range of goals. So for instance, being close to my being close to my partner might be a way of me to establish intimacy and have more closeness in my life. But if my partner really likes to travel, then being close to her might also be a way of being able to travel more. So one means can attain lots of goals, and goals can be attained by lots of different means. Now there's some very interesting work, for instance, Franz Casper in the psychotherapy research field has developed with Klaus Graber, his mentor, has developed something called plan analysis, where they really use in a very in-depth way to think about the clients and the patients they're working with in terms of these hierarchies of goals, of plans they call it, and that gets used then as the formulation for working with a client. It's very interesting work to have a look at if you have a chance, because it links, I think, very interestingly to the work that we do in the meaning-centered field. So if we take this model of hierarchy of goals, which a number of people, as I say, have been developing and thinking about, how do we understand how people's psychological problems, why is it that if people have these neat hierarchies, attain their goals, their meanings, their purposes in different ways, why is it that people sometimes experience psychological problems? Well, where the best research is to suggest that one of the big problems is when somebody's goals, somebody's meanings come into conflict, where there's a tension. I quite like the idea of dyssynergy as opposed to the idea of synergy. So when somebody's functioning well, their goals are very synergetic. They do one thing, like they strive for intimacy. And in striving for intimacy, they can also get another goal met with the principle of multifinality. Like, for instance, it allows them to travel. And when somebody's got a good life, these kind of goals go together. The partner they love, they can be close to the partner they love, and the partner they love loves the same food that they love, so that they can be close and they can eat the same food and they can travel. You know, great synergies. And it's interesting, actually, you can also take that onto the social level and think about synergies between people. But the opposite of that is dyssynergy. And dyssynergy is where, when you're trying to get to one goal, actually what you're doing is impeding the other goal. So that, for instance, you've got a partner, but your partner hates travelling, they just want to stay in Toronto, or they just never want to leave New York. So that you want to be close to them, and you want to have that intimacy, and you can get the need for intimacy met when you're close to them. But the problem is, by being close to them, runs up against other goals that you have in your life. And there's really good evidence now, across a number of different fields, that conflicts across goals is related to poorer psychological well-being. They have various ways now of measuring the kind of degree of synergy or dyssynergy in people's goals. And again, Mick shows that where the goals are coming into conflict is associated with more psychological distress. One of the most interesting ones, I think, and one I see often in my clients, is that clients often, perhaps for relatedness reasons, that they really want to be genuine, they want to be authentic in their relationships. But they also have a need for self-worth. And perhaps because of their childhood and how they've learned to develop self-worth, the way that they strive to attain self-worth is by hiding their vulnerability. They don't want to be seen as vulnerable. And of course, when we're authentic with people, it requires us to be vulnerable and requires us to be open. And if we're trying to be close, but we don't want to be open, then that's going to create a conflict that it's very difficult to be close if we're not open, and being open can make it mean that we can't really hide our vulnerability. So a kind of common tension I see in my clients is this one of, I don't want other people to see my vulnerability. I can't bear it for other people to see my vulnerability. It's a real avoidance goal. But that really runs against this one about I desperately yearn for closeness. I really want to be close with people. There's a lovely series of cartoons that I think illustrates this so beautifully by a woman in Poland who very kindly let me use her drawings. This is the first one. Somebody knocking on the door and saying, "Hi, do you want to be friends?" And the other one back, so, and I think I've seen that in my clients a lot. This is the second one. A really poignant series of images about just that conflict that you have when you want closeness, and actually people don't stay around forever and think, what's going on, and then they eventually go the things that you want, you're on your own again. So I think one of the reasons people don't get into difficulties, if you like, is because their conflicts are running up against each other. I think the other one is that sometimes people just aren't very good at getting what they want, and here the cognitive and behavioural approaches can be very helpful in thinking about that for us. For instance, somebody might want relatedness and work with clients who really want to be related and want to be close with other people, but the way that they do that is that in fact, just think about my son. My son loves maths, and he's only 8, but he's very into algebra and algorithms and square roots. And if he wants to make a friend, the first thing he'll do is he'll go up to them and he'll ask them to recite the periodic table. Now he can do that. He can reel off all 118 elements because he knows the song. But to be honest, it's not the best way of making friends. I've been trying to tell you, I don't have much skills myself, but we've been kind of talking about this, about how you make friends. But I think in life, often we just don't have the skills to develop relationships, to build our self-esteem, knowing how to think things through. I think the cognitive approaches can be very helpful in helping us think things through. And if we're not good at getting the things we want, then that can often lead to problems. And again, there's lots of really interesting research around what's called implementation intentions, which is something quite similar. It's the idea that if we want to achieve something in our lives, one of the most basic determinants is having plans of how to do that. If we want to give up smoking, it's not enough to say, I want to give up smoking. We need to have steps, we need to have plans. And working with people or change where they have specific plans in place, and again, shows that that's such an important part of getting to where we want to be. So I think this kind of tree structure, although it's very simple, provides quite a useful integrating framework for a wide range of different models. In the humanistic model, what we particularly talk about is the difference between the desire for social approval. It's lighter because it's often unconscious, but we want people to approve of ourselves, we want people to like us, and that might come against our other kind of parts of our being. So it might be that our sexual desire, the part of that is gay desires, that we want to have sex with other men, and but that runs against this desire to be approved, and that there's a conflict between those parts of ourselves, the authentic part of ourselves, and also the desire for social approval. And in the humanistic model, it's that desire for social approval that so many things run up against. Or in the psychodynamic model, we can think about the conflict between the ego and the things that come out of that around mature relating versus a more unconscious, and again, often unconscious, the fear of abandonment, for instance. And underneath that might be a kind of critical blaming approach. And then, on the one hand, we're trying to have mature relationships with other people, talk about things. But on the other hand, we get very critical and we get attacking because actually we want to, we're afraid, we want to hold on to somebody, and that's how we go about expressing that. Or in the cognitive model, we can also think about the cognitive model in terms of this kind of conflict that on the one hand we want to make rational choices, a bit like the psychodynamic model. But if you read the cognitive theorists, they also say that, why do we take shortcuts and why do we get into trouble? We get into problems because we take these cognitive shortcuts, and we do that because we don't want to deplete our ego, we want to be kind of lazy. And that's understandable, but But then we end up doing things like all or nothing thinking that runs up against this desire to make rational choices. Or the behavioural model, we can think about people just not having the skills, like poor social skills. And in the meaning-orientated model, of course, I think this kind of way of thinking about things is absolutely intrinsic to the meaning and existential models. So, for instance, in our meaning-oriented models, it may be, and I'll talk a bit more about this later, that we don't know really what our highest level purposes are, those things that we're striving for. We might have a sense that we need some meaning in our lives, but how we actualise that and how we actually then make that happen remains unconscious. And it may be that through our meaning-oriented work, we realise that what is really meaningful for us, what fulfills that sense of meaning, is to be creative. And that we can do that through music, and maybe then we'll join music group. We can see that linking to Paul's work around, for instance, discover hidden meanings, that we go from not recognising what our meanings are, they're kind of there but they're unconscious, to discovering them. And also a commitment to actually thinking about how we then make those meanings happen and bring them to life. So what I think we can say, and what I want to suggest, is that therapy across orientations is about helping clients find better ways of doing things to get to where they want to be, things that are more synergetic and things that are more effective. So going from kind of diegetic relationships, for instance, between relatedness and creativity, between that, young boy has a desire for social approval, wants people like him, but, if you see Billy Elliot, maybe wants to dance and really enjoys that dancing but feels ashamed of it. And he grows up and he's kind of lost because the thing that he loves and the movement and the art and the creativity that he loves, he's not doing because he feels that that's going to break his relationships with people, that people won't like him anymore. And then what happens in the work is that through the therapeutic work, he becomes more aware of that. He begins to see that structure, that it's no longer unconscious. He sees that what's running up against, he recognises that he has a desire to be creative. He recognises that he wants to dance and he wants to move. But he also recognises that what blocks that is that desire for social approval. He sees the conflictual relationship. And then what he can do is start to reconfigure it. And there's some very nice cognitive theories like methods of level, which just allow people the space to think about how they can reconfigure and allow these things to be shaped in different ways. And maybe what he can realise is actually being socially approved by others. Okay, you get a bit of a short-term kick out of it, but actually it doesn't really fulfil that desire for relatedness, and it just runs against everything else. Maybe what he realises is that actually his relatedness can become through love by people who accept him for who he is. Maybe he can change his social environment so that he's around people who are loving, and then he moves from a diegetic relationship to one that is synergetic, that he's loved. And the more that he's loved, the more he can be creative. And the more he's creative, the more he's loved. And he moves from that conflictual split self towards something that is much more self. And I think therapy can facilitate this process in a number of ways. Partly through insight, through becoming conscious of what's unconscious or latent in that structure, re-evaluating it, reconfiguring it, redesigning it, finding better ways with our therapist of doing things, and also simply sometimes through learning that all these things come together and can help that. And just to say, this is again, this image is from this Polish one. I think that's the most beautiful image of what happens in therapy, of helping somebody with a whole tangle in their mind and just feeding it through for them and letting them knit something beautiful for it. And I think that's what we do, going from that tangled mess to something that the person can really feel proud of by facilitating that process in this way. So, I've suggested that there's a kind of common model that we can think about in therapies and how therapy works, and that a number of people are moving more towards that model as a way of bridging not just the therapies, but also the therapies and psychology in many different fields. But I wanted to talk about, so what's the unique contribution then of the meaning-centered and the existential therapies for that shared model? And I think the first is that what we really contribute is a philosophical depth and a richness to these models that many of our philosophers, Frankl and Scheller and Heidegger and Sartre, have all thought so deeply about this question about what it means to be a person, and not just talked about goals in a kind of basic sense, but have talked existentially about the inherently future-orientated meaning of being and the nature of being. Sartre, for instance, says man, first of all, is the being who hurls himself towards the future and who is conscious of imagining himself as being in the future. That through the ideas of these existential philosophers, we can develop a richness of understanding what it means to be future-oriented, how that links to the past. The existentialists don't say ignore the past, ignore the present, but they look at the warmth and the weft of the future tied up with these different temporal dimensions and how they all link together. I think secondly, what a meaning-oriented approach does is it really foregrounds these higher order wants. Whereas focusing on the kind of more basic levels about how do I make friends and kind of behavioural interventions, it really asks these questions about what are the things that people really want in their life, that what are the things that we really strive for. Is it things like faith, for instance? Is it things like making a contribution to our community? Is it around creativity? That it takes the level of thinking and the level of analysis right up to the highest possible levels in our field. And I think perhaps most importantly, what it does is that it moves away from a very kind of biological needs-based model. So if you look at something like plan analysis, or even to some extent self-determination theory, what they say is that at the highest level is these kind of basic biological needs for pleasure or for relatedness. And I'm sure we've all agreed those are very important higher order needs, but a meaning-centered approach starts to introduce the idea that right at those higher levels may be things that are more value-based, about ethics, about nobody in the other approaches talks about faith. That the idea that our highest order need, our highest order want might be around faith and a sense of spiritual connection. Or that it might be about contributing to our community. Rather than thinking about hunger, even in Maslow's hierarchy, that perhaps most fundamental to us, to individuals, might be those contributions, or perhaps something like creativity. And because we can think about those higher order needs as being value-based, we can also think about how they can be found in other situations, that there's always that reconfiguration that if somebody can't have perhaps the physical pleasures now, that when we think about those highest order needs as being conceptual, as being values, as being ethics, then it allows for more flexibility and more possibilities as a way of meeting them through that multifinality. I think also what we contribute from an existential standpoint is to say, we don't have to say that everybody has the same hierarchy of wants. As Franz Casper has done with plan analysis, that we can understand that they may be very individual, that for me these may be the most important wants and that I may go about it trying to do it this way, but that somebody else may have a very different set of needs, and rather than saying like the self-determination theory is this and this is the highest order needs for everybody, it may differ very much for individuals. And that becomes very important given the existential commitment to relating to each individual as a unique person. Thinking about each person in their individual ways as somebody who is striving for their own journey. Frankl, for instance, and also Martin Buber, there's another quote from Martin Buber, talks about the way that each of us has an individual destiny, if you like. Buber says, "For as the needle of the magnet has chosen from all the points of the compass north, so the soul from the beginning has chosen its direction." It very resembles Frankl's view that meanings are not something we discover, but that meanings are something which meanings are not something that we create. It's very against Sartre's idea, but much more meanings are something that we discover and that they are there. And if we think about ourselves and each of us as having these individual meanings, then that hierarchy, that tree of desires, is there within each of us. Some of it conscious, some of it we can see, some of it is latent, some of it unconscious. And each of us is on our own individual journey to undiscover, to see the leaves of that, to see the subtleties, to see where it's going, that we can each find and discover our own unique journey, our own unique pattern within that, where our soul is taking us. I think, I've talked a lot about purposes, and there's a very interesting relationship between meanings and purposes, and I think often we don't talk enough about, in this field, about what the similarities and what the differences are between meanings and purposes. But I think there's something about purposes tend to be towards the future, whereas meanings are things, we can actualise meanings that may be about our lives as they've been. Bill Breitbart and people who are working more, and Joel Voss and people who are working more in the cancer-related field. Sometimes actualising our meanings is not just about where we're going, but it's also about recognising what we have done and what has been meaningful in our lives. So we may be working with a client, for instance, where contributing to the community is a really important meaning, a really important purpose. And that's for them, but they don't recognise that they've actually done that. And it may be that the work in the therapy is about recognising that they've been a really good friend to their neighbours, that they have contributed to that community, and that they've also been reliable and consistent. They've been a bedrock of that community. That it's not about, I've got to go out and do things, now I've got to go and contribute to this community. I think some of the most powerful interventions can be about recognising what I have done, and that the meanings and the purposes that have always been really important for me. Whereas I spent all this time thinking that I've never achieved that, I've never had the satisfaction of knowing that those are the things I've done, that actually I can see that I have done that in my life, that it's okay. And then going back, when we were talking about meanings and well-being, that the satisfaction that can come with that sense of I have contributed, I have made that difference. I think also when I was talking about why people struggle, I was saying it's about conflict, it's about not being able to find ways of actualising meanings. But I think the meaning-oriented approach opens up another really interesting possibility, that it may not just be about conflict, but it may also be about sometimes we just don't know what our meanings are. This is really where the Frankel's work and the meaning-centered therapies are so strong. That, we might even feel that we've been a good friend, or that we've been a reliable member of our community, but, we may have kind of gaps in our sense of what is this for? Why are we doing this? How does this achieve some sense of meaning? We may know we want meaning, and there the work may be about helping people recognise what it is that they have done and how that they have contributed. And then also what we have in our field is that we've developed some really good methods for helping people think about their purposes, think about their meaning. So we have things like existential attribution from Paul, about asking people why questions so that they can track back to what were the most important meanings and purposes. Why is it important for you to relate to people in equal play? That kind of questions can help people go up a level and understand what's at the highest level. Or fast forwarding, asking clients to think about their future and then think about where that would take them and what's important for them. Magical thinking, another one suggested by Paul, to get people to think about new possibilities. If you could be wherever you wanted to be right now, if your life was fulfilled right now, what would it be? It can help us recognise those higher order needs. Another one by Stephen Schulenberg, inviting people to think about their lives as a movie and thinking about how they can get and what it would look like, what would be meaningful in that, wherever they want to be going. Now this is one I think that is more perhaps for the more existential amongst us, and I guess one of the big debates in the existential field between people like Frankl and people like Sartre or Yalom is this question about is there ultimately any meaning or purpose. But I think, if we recognise that maybe even if we don't agree with that position, that it's a useful position, one way of thinking about that structure, that tree of desires, is that we may have these higher level needs like autonomy, relatedness. We may even have the level above that of a need for meaning. But for people like Sartre, people like Yalom, ultimately there is nothing above that. But there is no ultimate meaning, but there's nothing there. There's no kind of highest level that we can really say this is really there for a purpose. As I say, Frank would very violently disagree with that. But many of the existentialists have argued that, and when people are in crisis, this is the kind of picture they see, that I'm doing all these things. I'm doing my work, and I'm going to my job, and I'm doing my college, and I recognise that I'm doing that to get a degree, and I'm getting a degree because I want to succeed in my life. But why am I doing that? Why does it matter if I succeed or not? There's a great, big, existential vacuum that can exist for people. And I think, what we do in the existential field is that we can recognise that. And we can say, okay, how do we work with that? How do we help people maybe recognise that there are highest level structures, or maybe that it's about sitting with people that in that sense of nothingness and thinking about, how do we ultimately deal with that. But I think what is unique about the existential perspectives is that it's the only one that raises that possibility and genuinely welcomes clients to talk about that and looks at that balance between meaning and meaninglessness. I'm just coming to the end, but I just want to talk about another couple of things. One is that I think it's talking about the kind of more social and political aspects. I think these models and these hierarchical models have been very powerful, but they tend to be very intrapsychic, and they tend to look at what happens inside the person. And I think what we can recognise is that when we think about people actualising purposes, actualising wants, it's not just what goes on inside somebody and how somebody reconfigures it, but it's also about some of these external circumstances. Things like racism, things like prejudice, things like poverty are all fundamental to shaping the extent to which people achieve what they want. Yes, I'm sure Frankl's right, that even in the most suffering of circumstances, we can still find meanings, and I was saying earlier about we can reconfigure what we find meaningful. But at the same time, those external circumstances do fundamentally shape what is possible and what kind of refigurations we can make. Our external circumstances shape the extent to which we can attain our goals. It shapes how effective our methods are going to be. That if we're in an environment of very hostile people, for instance, critical people, getting self-acceptance is going to be much more difficult. And just to say a little bit, most interestingly perhaps, our environment really shapes the extent to which our wants are in conflict or synergetic. So we might think that, that's something that works out internally. But actually, if we analyse that, what we can say is that, if I'm in, for instance, a financially supportive environment, then I can be creative. If there's lots of money around, if I'm very rich, I can be creative and I can do my art and I can do all these things I want. And I've got financial security. Both of these desires can be fully achieved and there's no conflict between them. But what happens is that as that environment becomes more restricted, so the things that I want become more forced up against each other. Now, if I want to be creative, I want to be an artist, if I want to sit and explore my inner self, that means that I may not have the financial security, or I can go out and get a job at McDonald's, but that means that I can't then actualise my creative self. So the extent of the conflict is partially determined by this external world, and it works in an interpersonal way as well. If I'm in an unconditionally accepted environment, then I can feel good about myself, and I can express my sexuality in whatever way I want to. There's no conflict there. I can be, people accept me for just who I am. Then I can be sexual, I can be gay, I can be trans, I can be all these wonderful things. And that doesn't run up against anything else. But if I move into an environment that's more conditionally accepted, that says, you can't be like this, you can't be like that, then these things start running up against each other. Then I have to start making choices. Either I can be myself and feel good about myself by being approved by others, but then perhaps I have to suppress aspects of my sexuality, or I can express my sexuality in whatever way I want, but then I face the judgment of others. So I think that what that means is that when we think about a kind of hierarchical model and we think about change, that we also need to think about social change as well. And I know within our counselling psychology field, in the humanistic field, there's more and more people are talking about the importance of social change, social justice, that it's not something separate from psychological change, but it's absolutely intrinsic. And I think one of the nice things about this kind of hierarchical models is that it allows for the possibility of understanding social change as well as psychological and moving away from a very intrapsychic model of change and possibility. Just the last thing I want to talk about then, and then we'll have some time for questions and some comments, I think, if that's okay. It's just about what can we in the meaning centre field learn from this kind of hierarchical model? How can it help us? And I think one of the first things is that it can help us develop an understanding of this psychology, as I was saying, that there's really good psychological evidence out there. Now, I'm not saying that wants, desires, plans, purposes, meanings are all identical, but I think there's a lot that in the meaning centre field, when we're thinking about how we help people to find purposes and direction in their life, that we can draw from that and draw from the psychological evidence around approach points, goals, around intrinsic, extrinsic, as a way of helping people think about what makes constructive, positive purposes for people, how they relate, how it relates to well-being. It's a real kind of gold mine of evidence out there that I think that we can be drawing on. And I think secondly, I don't think anybody in the meaning centre field, or Frankel would be the first to say this, that just focusing on meaning doesn't explain everything. But we can begin to broaden that out a bit, thinking about not just about do people have a sense of meaning in their life, but how much are they moving towards meanings? And how much of their meanings are in conflict with each other? Or how much are they synergetic? And how much of their meanings are intrinsic and extrinsic? And I think as we start to broaden that out and think about the different ways in which meanings and purpose and well-being relate, so we start to build bridges between meaning-oriented approaches and the wider therapeutic community, and think about meaning therapy, meaning-based work, not something separate from other therapies, but something that is actually fundamentally linked and embedded in wider questions of therapy and psychotherapy. And I think that also to think about, when we do that and when we build those bridges, we can then also start to draw on many of the different methods that are out there as a way of helping people develop insight and to think about the way that they develop in their lives and can change their lives, including the social change dimension of bringing that in. And that kind of comes onto maybe a more integrative way of working that I'm sure many of us in the field of what I was doing a workshop on yesterday was about pluralistic therapy, about bringing in lots of different methods in collaboration and shared decision making with clients. So just to conclude, I guess what I wanted to say is that meaning-centered therapies are one of several newly emerging psychological psychotherapeutic models based around this teleological, future-oriented understanding of people. These models may be powerful tools, forging an integrated understanding of psychological problems and change, with the capacity to also integrate a socio-political understanding. Existential and meaning-centered traditions, what we do has a unique contribution to make to this evolving framework, this evolving model, but there's also much that we can learn from it. Thank you. So if you're interested in the slides, you can download them from the Research Again site. Have we got time for some questions?
Yes, 5 minutes. Sure.
Okay, we've got a few minutes. Yeah, there's one over here.
I think it's more of a comment and something that I've, as a student psychotherapist, and something that I've been through.
Check. I guess it's a comment on the idea of the external factors in attaining or realizing or self-actualizing meaning. I think taking into consideration the impact that has on the individual is extremely important, and then I think the self-reflection of our own location within society and the intersections of our own identities that come into play in the power dynamics that can be sort of named within the relationship that can help open up that up to something that can be useful within the therapeutic relationship as well, if there's a lot of sort of cultural or gender or ability differences and things like that. And it's something that I noticed that isn't quite pushed in our education or schooling around that self-reflective social location practice. So I just wanted to sort of say that because it is sort of...
You take meaning in the sense of is there an ultimate meaning? But I think where they do come up, they're very, very profound questions. And sitting with it and kind of listening to that, I guess, and understanding first of all where somebody is at and what those